The participants will get
before
15
and
seconds
after.
to answer each question. So once I finish reading the questions and giving you the choices, it will be 15 seconds from that point of time. So I'll repeat that again. If I read a question, then the choices, then I say your time starts now, your 15 seconds will start at that point of time. You will not be able to answer the question when I'm reading it out, even if you know the answer. So please press the correct answer only, or tick on the correct answer only when I say your time starts now and your timer starts. If you have pressed before that, your answer becomes null and void. Okay. So the top 3 participants who give maximum correct answers in the least time will be declared as winners at the end. And any technical problem that you have, unfortunately, I hope none of you have any technical problems. But if there's a problem with bandwidth, if there's a problem with your audio, video, etc., we will not be, unfortunately, able to help you. It needs to be sorted at your end. And it probably might mean that you get knocked out for technical reasons for the quiz. So the first question is there in front of you. Remember, the time only starts once I've read the question and the answers, the MCQ. So considering the clinical course of pertussis, in which phase is whooping cough evident? Your choices are, number 1, can I have the choices, please? Tech team, you have to buck up. So the choices are incubation period, catarrhal stage, paroxysmal stage, and convalescent stage. So incubation period, catarrhal stage, paroxysmal stage, convalescent stage, and your time starts now. Tech team, I can't see a timer.
So on that audience link, the timer is
okay. So you'll have to tell me when the time finishes, because I wouldn't know when the time is finishing.
So time up. You can go for the next one.
So the next question, which of the following is correct? So which of the following is correct for conjugated pneumococcal vaccines? Your first choice is that they can be administered after 2 years of age. The second is that the immune response is T lymphocyte dependent. The third choice is that they have no effect on nasopharyngeal colonization. And the fourth choice is that they have no protective effect on in-community acquired pneumonia. And your time starts now.
So time up. We can go for the next one.
The next question, the question number 3 of this quiz, is considering the updated World Health Organization Strategic Advisory Group of Expert Recommendations published very recently in May 2022. Which of the following is incorrect? So mark my words, which of the following is incorrect? All live vaccines, MMR, varicella, yellow fever, oral typhoid may be given with seasonal inactivated influenza vaccine at the same visit if indicated. Any dose of COVID-19 may be given with seasonal inactivated influenza vaccine at the same visit if indicated. Influenza vaccination effectively prevents infection in pregnant women as well as in their offsprings through the transfer of maternal antibodies. And choice number 4, high dose inactivated vaccines are primarily intended in healthcare staff. And your time starts now. Dr. Selvendran, we won't be able to allow you to talk. So you've got your hand up. Please put your question on the chat box and Vinod and team try and answer the question that he has.
So time up. We can go for the next one.
The top 10 threats to global health in 2019, amongst others, includes which one of the following? 1. Weak tertiary care. 2nd, global influenza pandemic. 3rd, vaccine demand. And 4th, chikungunya. So which one amongst these 4 is within the top 10 global health problems in 2019? And your time starts now. So you guys are not supposed to put your answers into the chat box. You're supposed to answer on your own on the box. Don't put your answers on the chat box. People can see your answers.
So you can go for the next one.
So the next question, Paxlovid is a COVID-19 treatment containing nirmatrelvir and which other drug? So is it molnupiravir? Is it ritonavir? Is it oseltamivir? Or is it favipiravir? And your time starts now. The next question, an effective hand sanitizer contains at least what this percent of alcohol to kill the coronavirus and other germs? So an effective hand sanitizer has to contain at least what percentage of alcohol to kill coronavirus and other germs? Your choices are 1, 30%, 2nd, 45%, 3rd, 60%, and 4th, 80%. And your time starts now.
Next question.
The next question, identify the false statement. Remember the false statement about influenza virus subtypes A, B, and C. Which one is false? So the first choice is that influenza type A may be found in chicken, pigs, and horses. 2nd, antigenic shift or the viral genome reassortment occurs in influenza A virus. 3rd, all 3 types of viruses are found in humans and other animals. And 4th, influenza virus mainly the upper respiratory tract. And your time starts now. False statement is what you need to say.
Next question.
So the next question, the properties of orthomyxoviridae include all of the following statements except, again, which one is false? The virus consists of a single-stranded RNA. The outer envelope of the virus is made up of a lipid bilayer. The size of the virus, which is 150 nanometer, is larger than that of the paramyxoviruses. And 4th and last choice, the hemagglutinin and neuraminidase of the influenza virus helps to attach to the host cell. So which one is false? And your time starts now.
So next question.
So question number 9, identify the influenza virus serotype that causes the most number of epidemics. Which influenza serotype causes the most number of epidemics? That's an easy one, guys. So choice 1 is type A, choice 2 is type B, 3rd is type C, and 4th is none of the above. And your time starts now. Question 10 is there in front of you. This is the long worded question. So listen to me carefully or read the question carefully. The most common route of transmission of the influenza virus is airborne droplets. Which of the following type of the virus is considered highly contagious and is known to spread rapidly from person to person? Which of the following types of the virus is considered contagious and is known to spread rapidly from person to person? First choice is influenza A, second is rhinovirus, third is influenza B, and fourth is all of the above. And your time starts now.
So next question. So
Okay,
1 minute.
so
I have
what
to
we'll
show the
do is,
results.
sure. So what we'll do, guys, we'll stop. That's halfway in the quiz. So we'll stop for a moment. We will see the leaders.
So these are top 7. Correct.
Top 7, right? So no one has actually got all 10 right. So that's good. So people who have been complaining that they have not managed to get one answer because of problems, they can't complain. So it's Jocelyn Anna Joseph with 8 right answers, having taken a total of 48 seconds to answer these 10 questions. Wonderful, Jocelyn. That's amazing time. And then not far behind at all, but with one less answer, there's Dr. Lakshmi Narayan Jasti. Dr. Vishal Raj comes after, Dr. Ankita Mohanty, Dr. Aditya Agarwal, Dr. Shamurjit Das, and Dr. Jignesh Kumar Patel. So guys, nothing is lost. There's a long way to go in this quiz even now. So if you can unshare the screen, we'll show you the leaderboard again after question 15, which will be 2/3 of the quiz. But don't lose heart. There's a long way to go. As you can see, the questions are not as easy as I made them out to be, maybe. And there are technical challenges. So buck up, concentrate. Here comes the second half of the quiz for all of you. So question 11, guys, concentrate. All of the following statements are correct about neuraminidase and hemagglutinin of influenza virus except. So remember the except. The choices in front of you are: 1, helps the virus to bind to the host cell surface. Second, both of the antigens are embedded in the outer surface of the viral envelope. Third, neuraminidase is present as a spike and is composed of dimers. And fourth, frequent antigenic changes occur in neuraminidase and hemagglutinin. And your time starts now. So question number 12, a 16-year-old girl came to the clinic with sore throat, fever, and headache. The symptoms resembled seasonal influenza flu. Which of the following primary samples or specimen is collected for the lab diagnosis of influenza? So that's the question. Your choices are: 1, blood sample; 2nd, sputum sample; 3rd, urine sample; and 4th, nasopharyngeal sample or nasopharyngeal washing. And your time starts now.
Five seconds more. Next question, sir.
Wonderful. So question 13, which of the following statements about isolation and identification of influenza is not correct? So not correct is the question. The specimen should be kept at 4 degrees Celsius. Second, the culture of the virus is usually done by using embryonated eggs. Third, the specimen should be taken within 1 to 3 days after the onset of symptoms. And fourth, rapid antigen detection tests cannot be done. And your time starts now.
Five seconds more. Time up. Next question, sir.
Question 14. Which of the following is a reservoir for the antigenic shift variants of influenza virus? And your choices are 1. Pigs and horses. 2nd, rodents. 3rd, mosquitoes. 4th, human. Easy question. Your time starts now.
Some more 5 seconds. Time up.
And the next question, influenza virus can be easily killed by using which of the following agents? Your first choice is high heat, second choice is water, third is ethanol, and fourth is detergent. Remember the question, it's easily killed by using which one? What is the best for killing is the question, and your time starts now.
So time up. Next question.
Wonderful. So what I'll do is I'll wait again. We'll see the leaderboard again, Puneet, if that's okay. Wonderful. So at 15, the maximum number of questions answered right is 10. So that's not a huge number, 10 out of 15. So Jocelyn holds on to her first position, but now the change is that she's got 4 others who are hot on her heels, also at 10 correct answers. So Lakshmi Narayan Jasti remains at position number 2. Vishal Raj remains at position 3. Nazma Saqib comes in as a new entrant at 10 answers. And Ankita Mohanty is also at 10 answers. And hot on their heels is Dr. Archit Krishna and Dr. Hitesh Charan. Let's see the timings. So almost nothing, as you can see, these positions will probably change unless Jocelyn, Lakshmi Narayan, Vishal all buck up. So 1 minute, 12 seconds for 15 questions is the best timing from Jocelyn. Just behind that is Dr. Lakshmi Narayan Jasti, 10 seconds behind her. And then a little bit further back, about 24 seconds behind that, or 20 seconds behind that is Vishal. And 5 seconds behind that is Nazmus, and so on. So nothing to choose. Time is crucial. Getting the right answers is crucial, guys. If you can unshare the last 5 questions coming up. Question 16. Average number of secondary cases are 0 from a single primary case is the greatest width. So in other words, just to make things simpler, the question is, if you've got which disease does one primary case result in the greatest number of secondary cases? So the infectivity potential is the greatest with which of these? So choices 1, sorry, where is it? So COVID-19 is choice number 1, influenza is choice number 2, pertussis is choice number 3, and pneumococcal disease, so pneumococcal pneumonia is choice 4, and your time starts now.
Five seconds more. Set time up.
So question 17, which of the following common medical condition increases the risk of pneumococcal pneumonia the most? So which is the risk factor out of the ones we are enlisting, which increases the risk of pneumococcal pneumonia the most? 1 is diabetes, 2 is chronic liver disease, 3rd is smokers, and here we mean smokers of more than 20 pack years, and 4th is COPD. And your time starts now.
Last 5 seconds to go. And timer.
Question 18. Ample evidence to show that human transmission normally happens in this disease from dromedary camels. So there's a lot of evidence to show that human transmission normally happens in this disease from dromedary camels. Which viral disease are we talking about? Is it SARS-CoV-1? Is it MERS-CoV? Is it respiratory syncytial virus? Or is it adenovirus? Dromedary camels, your time starts now.
Last 5 seconds to go. Time's up.
The second last question of the quiz, guys, buck up, is going to appear in front of you in the next second. So the next question, long-worded question, I'll take my time reading it slowly. This negative sense, single-stranded RNA virus usually causes mild illness in children and more serious infection in immunocompromised adults. Prophylactic palivizumab is used in high-risk infants to prevent infection with this virus. Which virus are we talking about? And your choices are: number 1, adenovirus; number 2, coronavirus; number 3, respiratory syncytial virus; and number 4, rhinovirus. And your time starts now.
Last 5 seconds to go. Time's up.
So we show you the leaderboard now, guys. There's one question left. Let's see how we are positioned, whether the last question is going to make a difference or not. So leaderboard again, Puneet.
Yes, Ash.
Right. So we've changed positions actually. So, and very closely clustered again. Dr. Lakshmi Narayan Jasti and Dr. Vishal Raj have taken over for Jocelyn, who led this quiz wonderfully well till about question 15. So clustered together with 13 right answers are Lakshmi Narayan and Vishal. They've taken, there's a small difference of time between the two. 18 seconds is the time difference between Lakshmi Narayan and Vishal. Jocelyn comes in close behind them. Her timing note, though, is the best we have. So at 1 minute 33 seconds, she's still the fastest in the quiz. But again, tied with her are Nazma Saqib, Jignesh Kumar Patel, Ankita Mohanty, and Archit Krishna closely behind at 11. So all the ones in the first 6 who are with 13 and 12 points can still win the quiz, depending on the last answer. So the last question of the quiz, when I share again in a moment, the next question, the last question, which of the following is true as per NIH guideline for antiviral treatment in COVID-19? Which of the following is true as per the NIH guidance for antiviral treatment in COVID-19? Your first choice is ritonavir boosted nirmatrelvir or Paxlovid is the preferred choice of treatment for non-hospitalized patients with COVID-19. Choice number 2, outpatient remdesivir is not advocated for outpatient management. So the two outpatient is twice, I'm sorry. It should say outpatient remdesivir is not advocated for management in the NIH guideline released recently. Third, ivermectin is recommended as an alternative when the preferred choice is not available. And choice number 4, molnupiravir is approved by FDA for use as a second line agent for use in high-risk patients with COVID-19. So long choices. Your time starts now.
Last 5 seconds. Time's up now.
Well done, guys. Let me tell you the right answers, and then we'll go to the final positions of the quiz, and the team will tell you the positions in a moment. So let me share the answers with you guys while we are waiting. So this was the easy one to warm you guys up. Considering the clinical course of pertussis, in which phase is whooping cough evident? All of you know that the cough is supposed to be paroxysmal. That's why it's called whooping. So the answer here is a no-brainer. It's a paroxysmal stage in which the whooping cough becomes evident. So that's the answer, paroxysmal stage. Question 2, which of the following is correct for conjugated pneumococcal vaccines? You saw the choices. The answer here is the immune response is T lymphocyte dependent. So for the incorrect ones, the fact that the pneumococcal vaccine can be administered in infants, that is normally what's done. You would do the first dose at 2 months, then at 4, then at 6, and then at 12. So it's done well before 2 months. It does have an effect on nasopharyngeal colonization. The vaccine reduces nasopharyngeal colonization, and the fact that they have a protective immunity in community-acquired pneumonia. However, the immunity in invasive pneumococcal pneumonia is greater. So that's why 1, 3, and 4 are incorrect, and 2 is correct. The next question, considering the updated World Health Organization Strategic Advisory Group of Experts recommendation published in May 22, which one is incorrect? So the choices that are there in front of you, the answer, guys, was asked. The high doses of inactivated vaccine are primarily intended for healthcare staff is not correct. You would want to give the most efficacious vaccine to your healthcare workers, and the nature of the vaccine need not be different in healthcare workers, which is why this is incorrect. The remaining choices, which are there at the top, that all live vaccines may be given with seasonal inactivated influenza vaccine at the same visit, is correct. Any dose of COVID-19 vaccine can be given with seasonal inactivated vaccine is correct. And influenza vaccination effectively prevents infection in pregnant women as well as their offspring through transfer of maternal antibodies is obviously also correct. So high dose inactivated vaccines are primarily intended for use in healthcare staff. This was an interesting question. I don't remember who gave this question, but I found it interesting. The top 10 threats to global health identified in 2019, which one of these is included? And the answer for an APACI quiz, obviously, is that it is the global influenza pandemic, which is included within the top 10 threats for global health in 2019. The next question, easy one. Paxlovid is nirmatrelvir plus which drug? And the answer is ritonavir. So nirmatrelvir plus ritonavir is Paxlovid. The next one too was easy, I thought. An effective hand sanitizer which contains at least minimum, what's the minimum percentage of alcohol that it must contain to kill coronavirus and other germs? And the answer, as a lot of you would have got this correct, I'm sure, is 60%. So 60% is the least percentage of alcohol to kill coronaviruses and other germs. Question number 7 was identifying a false statement about influenza virus subtypes A, B, and C. So those were the choices. The answer is that all 3 types of viruses are found in humans and other animals is incorrect. The other ones, influenza A found in chicken, pigs, and horses is correct. Antigenic shift or viral genome reassortment occurs in influenza A viruses is correct. And influenza virus infects mainly the upper respiratory tract and very rarely the lower respiratory is also correct. Question number 8. The properties of orthomyxoviridae include all of the following statements except. This I thought for me was a difficult one. This was given by our quiz team, our champion team who supplied us with these questions. So the choices were there in front of you. The right answer was the size of the virus is larger than paramyxoviridae. That's incorrect. The paramyxoviridae size is greater than that of the orthomyxoviridae. The right answers are that the virus consists of a single-stranded RNA, The outer envelope of the virus is made up of a lipid bilayer, and the hemagglutinin and neuraminidase of influenza virus helps to attach to the host cell. Question 9, identify the influenza virus serotype that causes the most amount of a number of epidemics. This I thought was the easiest question of the lot. That's type A. That's what we see the most in Southeast Asia also. So in type A influenza virus serotype causes the most number of epidemics. Question 10, the most common route of transmission of influenza virus is airborne droplets. Which of the following type of viruses is considered highly contagious and is known to spread rapidly from person to person? So simple, long answer, long question, but the right answer is again simple. Influenza A is the right answer. This is the most contagious and spreads most rapidly from person to person. Question 11. All of the following statements are correct about neuraminidase and hemagglutinin of influenza virus except. So the choices were helps the virus to bind to the host cell. Both the antigens are embedded on the outer surface of the viral envelope. Neuraminidase is present as spike and is composed of dimers, and frequent antigenic changes occur in hemagglutinin and neuraminidase. So this again is a difficult question, I thought, for clinicians who are on the platform. So the right answer here is neuraminidase is present as a spike and is composed of dimers. That's the wrong answer. The right answers are helps the virus to bind to the host cell. Both the antigens are embedded on the outer surface of the viral envelope, and frequent antigenic changes occur in hemagglutinin and neuraminidase. Question 12, a clinical question. 16-year-old girl comes with sore throat, fever, and headache. The symptoms resemble influenza flu. Which of the following primary samples or specimens is collected for lab diagnosis of influenza? And this one, while it's a long question, the answer is easy. It's a nasopharyngeal swab or nasopharyngeal wash. That's the answer that we were looking for. And I hope a lot of you got that answer correct. Question 13. Which of the following statements about isolation and identification of influenza is incorrect? Which of the following statements about isolation and identification of influenza is not correct? So your answer there is rapid antigen detection test cannot be done. So that's incorrect. It can be done. The right answers were that specimens should be kept at 4 degrees. Culture of the virus is done using embryonated eggs, and the specimen should be taken within 1 to 3 days after onset of symptoms. Question 14, which of the following is a reservoir for antigenic shift variants of influenza virus? The choices are there in front of you. The answer was pigs and horses. So antigenic shift variants of influenza, the reservoir is pigs and horses. Pigs mainly, that's the most important answer. The others are also act as reservoirs, can act as reservoirs, but antigenic shifts normally happen mostly in pigs and also in horses. Question 15, what can it be killed easily by? And I sort of stressed on the word easily there. What's the most potent? And it's high heat. Ethanol can also do it, but at very high concentration and for longer exposure. So the answer there is high heat, which scores above the other choices that are there in front of you. Question number 16, the average number of secondary cases R0 from a single primary case is greatest with. This I thought was an interesting question. These were the choices that you had, and the answer is pertussis. So one single primary case of pertussis can result in 17 secondary cases, 17. With COVID and influenza, it's about 6 to 7 secondary cases. Pneumococcal disease is about 2 cases. Study which came out in Nature about 2 years ago, which looked at this. Question number 17, which of the following medical conditions increase the risk of pneumococcal pneumonia the most? So which comorbidity gives you the greatest risk with pneumococcal pneumonia? Those were the choices, and I hope all of you got this question right. It was an easy one. The answer for pneumonia is COPD. So that results in about a 7-fold increase in the risk of pneumococcal pneumonia. All the others also increase the risk of pneumococcal pneumonia, but to a lesser degree. The last three questions, question 18, ample evidence to show that human transmission normally happens from dromedary camels. A lot of you would have thought this out, I'm sure, even if you did not know the right answer. The fact that camels are most prevalent in the Middle East. Which virus are we talking about? So you saw the Middle East respiratory virus included in that list. And the answer is the MERS coronavirus is the right answer to that question. Question number 19, the negative sense single-stranded RNA usually causes mild illness in children, more serious disease in immunocompromised adults. Prophylaxis in case of infants is with palivizumab. This is infants who are at a high risk of infection. And the virus that we're talking about, those were your choices. The answer is respiratory syncytial virus. So that's your answer, respiratory syncytial virus, for which prophylaxis is used with palivizumab for high-risk infants. The last question of the quiz, this is, remember the NIH guideline we're talking about, which came out recently. The NIH guideline, which one is correct? Those were the choices. And the right answer was the first one, the fact that Paxlovid, which, like we said in the course of the quiz, was a combination of ritonavir plus nirmatrelvir, is the preferred choice for treatment for non-hospitalized patients with COVID-19. The remaining choices are wrong. Outpatient remdesivir is advocated for outpatient management as a second line to Paxlovid. Ivermectin is nowhere in the guideline anywhere for NIH. And molnupiravir is not approved by the FDA in high-risk patients for COVID-19. It's not in the NIH list. There are other guidelines which have a small indication for molnupiravir, but not the NIH guidelines. So those were the answers.
Thank you, Raja. Look, that was really such an interesting exercise to go through. I thought there are obviously some quite simple questions, but there are others that were challenging. And I was really impressed with the speed with which some of these questions were answered. I mean, they were within a fraction of a second. That is remarkable. Look, I can't add anything more to it other than to thank everyone for being involved and to Kipler for making it happen. And Raja, you did such a great job of presenting this and dealing with all the questions. There was a lot of talking involved from your point of view, but handled beautifully. So thank you, everyone. I can't add any more to it. Thank you.
Thank you very much, Kim. Let's go on to the leaderboards. So if we have, do we have the presentation ready, guys? Yeah, top achievers indeed. I mean, everyone is an achiever. Whoever has been on the platform today is an achiever. But we'll start off with 10 to 4. So we'll start off with... So I think the least I can do is to read out the names. So 10th is Anubhav Maulik from Kolkata. 9th is Archit Krishna from Dindugal. 8th is Aditya Agarwal from Jaipur. 7th, Shaumurjit has not done badly at all. Dr. Shaumurjit Das from Kolkata. Nazmas Saqib from Kolkata comes in 6th. Ankita Mohanty from Jodhpur comes in 5th. And Jignesh Kumar Patel from Amravati comes in 4th. So 4th is very close. I'm sorry, we'll all give certificates to all 10 of you. Wonderful. So now comes 3rd next. So who is the 3rd position holder then? Dr. Vishal Raj, wonderful, from PGIMS Rohtak. Proud of you, Vishal, well done. So 3rd position goes to Dr. Vishal Raj from PGIMS Rohtak. 2nd position holder, please. Jocelyn Anna Joseph makes a comeback again. So Grant Government Medical College, Mumbai. Well done, Jocelyn. Wonderful. You maintained this position through the quiz. You were first for a long time. You fell a little bit and then you've recovered again. So well done, Jocelyn. Very proud of you. So Dr. Jocelyn Anna Joseph at number 2. And number one, who is the winner of the APACI quiz, Respiratory Quiz 2022? So Dr. Lakshmi Narayan Jasti from CMC Vellore. Wonderful. Well done, Lakshmi Narayan Jasti. Wonderful. Very, very well done. So you know the prizes. I showed you the prizes before. These prizes will be sent to you, will be taken to you by the CIPLA team. We'll have certificates for the first 10 people who've come in 10 from APACI, from ICS, and from API. So the certificates, again, will be sent to you in soft copy in the not so distant future. I have absolutely loved being a part of this quiz. We will arrange for the answers. I saw some questions in the chat box about some answers not being completely clear. So I will send you the answers along with the questions to all of you to circulate. You can keep them as your personal possession, as memories of this quiz that we've done online.
Just to close the meeting, this has been a fantastic session, our fourth session for this 2-day meeting, and I really appreciate everyone's participation in this. Very, very challenging on many levels, but really extremely entertaining as well. And I think that's such an important part of making these kinds of presentations. We just have a couple of reminders that there is a feedback form that's available in the lobby, and we ask that you complete that. And we welcome any suggestions you might have on how we can improve things. You know, working in this environment of digital technology, when we're trying new things, you know, blending one system in with another, it can be very challenging. And the tech team have been fantastic, and Exicon have done a great job. And I really appreciate the support that they provide to people such as myself, but obviously many of the other participants that have been involved. So I hope that we're able to do this again. This is the second year that we've organised this meeting. I hope that we can do it again, and you know, maybe we can do it with in maybe a hybrid situation. So rather than purely digital, that there can be some face-to-face potential there. But we'll have to see what COVID enables us to do. But I would like to thank everyone, and to everyone that's been involved with this, thank you very much, and good night or good afternoon, whatever time of day it is for you. Then farewell, and thank you for participating in this this workshop. Thank you very much. Bye.